Hi, thank you very much for coming this afternoon. My name is Dennis Probst. I'm the Health Commissioner for Miami County Public Health. What I will be doing is giving you a brief update of the situation as we know it right now, and then we'll have some other speakers discuss different aspects of the response. As of right now, there are 32 people currently showing symptoms that have been tested. Of those, 16 have been our residents, 14 staff, and 2 visitors. 8 of those individuals have been hospitalized. As of right now, 11 of those are presumptive positive, with the rest of the tests still pending. Of the 32 residents, 16 residents, 5 are hospitalized with onset dates ranging from March 11 to March 17. The age range is 53 to 94 years old, 8 female, 8 male. There has been 1 death, but this tests are still pending, therefore it cannot be confirmed as a death related to COVID-19. 14 staff have the onset date of March 9 to March 17. 3 of those individuals have been hospitalized. The age range is 16 to 76. 13 of them are female and 1 male. 2 visitors, we do not have the onset dates or the hospitalization status of those 2 visitors. We want to emphasize that this is a community spread. We know that is in Ohio and it is spreading within the community. The community needs to come together and do their part. What they need to do is follow the social distancing guidelines and the recommendations and the orders of the governor and Dr. Amy Acton of the Ohio Department of Health. Stay home, especially if you are sick. Avoid contact with those who are sick. And we cannot emphasize enough the importance of proper hygiene, particularly washing the hands. Miami County Public Health is diligently working with Koester Pavilion, Premier Health, Upper Valley Medical Center, the Ohio Department of Health, and identifying anyone who has been in contact with the positive cases. I'll turn this over now to India. She's with Koester Pavilion.
Hi there. My name is India Chrisman-Williams. I'm the Regional Vice President of Operations for AgCare Health Systems. We are engaged in a contract and manage Koester Pavilion for Upper Valley Medical Center and Premier Health. We appreciate you all coming. We appreciate you sharing this information and supporting our facility and operations. It is a trying time for our staff and residents and families. We have followed to the T every regulation, every direction that the state and national guidelines have allowed us to, and we've done everything we can to protect our residents and staff.
Hi, good afternoon. My name is Roberto Colon. I'm the System Vice President for Quality and Safety for Premier. And we've been assisting with a lot of the medical care responses that have been going on so far. One of the things that I was asked to speak to is how we've been preparing for this. I think everybody has been hoping for the best, but has been preparing for the eventual development of this disease in our community. We at Premier have actually been working on this as far back as January, when we began ensuring that we had adequate supplies of protective equipment for the ability to care for our patients and keep our personnel safe. As the disease has progressed in the United States, we have been increasing our response as well. This has included making sure that we have at every one of our facilities the ability to safely bring patients from every point of entry through our facility, and developing areas within each campus to be able to co-locate patients who either have COVID infections or are being evaluated for COVID infections, to be able to ensure that we have them in a cohabited location with a multidisciplinary approach to be able to care for them. We've developed treatment algorithms that we have implemented at all of our facilities as well, to be able to manage all these patients and have the ability to move resources from one location to the other. In response to all the cases that we have been seeing here at Upper Valley, with an increased acuity, we have been able to move resources to be able to increase the amount of protective equipment that we have available here for our personnel to be able to take care of our patients, so that our physicians and staff do not have to care for any patient without the necessary equipment to do so safely. So while we have been all anticipating that this was going to be coming into our community, and we have been putting our systems in place, we now are going to have to activate all those systems to be able to face the unfortunate situation of more cases developing in the area in the next coming days and weeks. Thank you.
I'm Ron Manis, Medical Director of Infection Prevention at UVMC. We've seen a number of cases occur in a very brief amount of time. What we've witnessed here locally is something that's well established in the country and in the world. We are very blessed to have a very strong medical system, and the components of our system locally, the physicians, the nurses, they've responded to this challenge in an admirable manner. They've stepped up to the challenge, as every community will have to do. I think what you see here is the beginning of something that will have effect in many, if not most, of the communities in this country. The shape and the form that it occurs will vary from one place to the next. People coming from a nursing facility, from a shopping mall, or whatever. But the challenge remains the same. It's individual people doing their best. We have the equipment to handle the emergency that has presented, and our staff has performed in an excellent manner. Again, we benefit from being part of a very good system, and we benefit from the knowledge that's been gained from the world and from our country. And we will continue to deliver the excellent care that our community expects.
A couple real quick closing comments. We've been getting some reports of some discriminatory practices that have been occurring based around this event. We've had vendors that have been refusing to deliver to the facility. We have businesses that have been telling employees of Koester Pavilion that they're not welcome at their place of business after this event. I expected better from Miami County in the state of Ohio. This is an extremely difficult and complex situation. These fine men and women are doing everything they can to contain this situation, and by taking actions like that, you are making it much more stressful, much more difficult for them to do their job, to take care of our parents, our grandparents, and give them the care they need. I would highly suggest that those companies and those individuals reevaluate some of the decisions they made, some of the choices they've made, and open up to the community. Now's the time to come together. It's not the time to cower in fear. It's a very unfortunate event, and I'll just leave it at that. We very much appreciate the partnership with Premier, Koester Pavilion, and ODH in the response to this event. And right now we'll field any questions.
When do you think you'll have the results back from the individual who passed away?
We do not know. We hope within the next 24 to 48 hours.
Commissioner Brooks, any idea at this point what was kind of the origin of the spread of this facility?
We have several individuals back at my office now trying to put together those pieces. ODH has sent down 2 epidemiologists to assist us in that process, and we do not know as of right now and it may take us weeks to figure out what happened or where it came from, and we may never actually. But right now our focus is on trying to contain this and treating the patients that are still there.
What's happening with the patients that are there right now?
Sure, we're following still the same. We're following still the same state and federal guidelines. We're treating symptoms. We're protecting our staff and our other residents. We're communicating with our families. We're allowing FaceTime. We're doing daily calls to some families that want an update. So we're still on the same course as we've been instructed to do. And so we're containing and communicating with our staff and employees as much as we possibly can, and still providing that quality of life in isolation circumstances in their rooms, because they do, our common areas are restricted. So, it's kind of, for them, it's their bedroom. So it's challenging for them too, because they like that socialization and they're not able to get that. So we're working through that.
The governor announced they're going to be closing down senior centers and if it's the same Monday, how did that impact you here? And then my second question is, are any of your staff working at other nursing homes? Is there, how many of them, and is there any concern that that might affect other homes now?
Sure. So the senior centers do not really affect us because most of our residents, they're either there for rehab, and so they're not going to the senior center for socialization. They're there for rehab, or that we do have the long-term care residents that is their home and their socialization is there. So really no impact for the senior centers for us. And so we are working with our staff. If they do have second jobs, we're following all of those guidelines that we've been given.
Do we know if any of those, your nursing staff goes to other facilities that maybe concerns you, possible spread of this?
Sure. Yep. But again, it's the same thing of all the guidelines they've been given. What do you do to protect yourself and protect those around you? And so they're following those same precautions.
Is that using the same kind of tracing with them and all to see if maybe they've learned from other homes?
That would be.
We are doing contact tracing with all the individuals, and those are questions that are asked on the contact tracing form is, do you have other employment? Where is that employment? So those are questions that are being asked and looked at.
Is there any way you could run through the totals again with the wind, I'm afraid?
Sure.
Didn't quite get it all.
32 people are showing symptoms, 16 residents, 14 staff, 2 visitors. 8 of those hospitalized, and 11 have tested positive.
What's the condition of people that are hospitalized? What's the condition? And does that include the deceased, the 8?
No. I don't have the condition. I don't know if they're asking on the condition of the hospitalized patients.
The hospitalized patients are in various conditions. We have a number of patients in the intensive care unit, and of those, a number are on ventilators. We also have people that are not so ill and on regular floors. So the age distribution is significant from younger to older, and the severity of the illness ranges from medical care to intensive care to respiratory support on ventilators.
How many are actually in, serious or worse than that condition?
At this time, we have on ventilation 4 patients, and as a consequence of being on the ventilator, that would be termed critical care and in need of very advanced life support.
And are they all older? Are they all older and are they all residents?
The people that are requiring ventilation at present range from very senior people to some that are not so old. People in their 40s, people that are afflicted range down into their 30s. So this is an illness that has the greatest affliction on the very old, but it can also strike younger people as well, people in their 30s and 40s.
What message do you want to say to the younger people who might have felt sort of immune to this since in China it wasn't one of the people?
It's a disease that affects many in many different ages. I think for the very young, there's 2 messages. Number one, think of your grandparents and such, because they are to be most afflicted. But number 2, you can carry the illness you can have lesser disease and be a vector to spread it about. And then finally, youth does not have absolute protection. Long ago, in the 1918 Spanish flu, the main target were people who had families, who were in the mainstream of life. And in the current situation, this virus can strike the young as well. So I would say to the young people, don't take chances, don't feel that you're immune. You're not only a vector for the old, but you're a potential person to be ill yourself.
Are you guys hearing any fears from your elderly who are here? I mean, you know, we saw what happened in Seattle with all the getting sick there, and now we have tons of people here. Are they scared at all? And what are you guys doing to help ensure them that they're safe, or that you guys are taking the right precautions here?
I think the elderly that I come across are a tough bunch. They have a resolve. They'll see it through. They ask questions, good questions. They have concerns. They take precautions. I think the elderly among us are a pretty responsible bunch. So they ask the right questions, they do the right things. I think the young folks could learn from the older folks. But to answer your questions, I don't see a sense of panic amongst the old. I see a resolve. I see a desire to see this thing through. I see a community strength in our older people.